You're really in a great location. What would you say to people who live in this area as far as your presence and what they can get here that they wouldn't be able to get at another facility?
I think one of the reasons that people like to come to our facility is one, we're smaller, but we have the ability to spend time with you, to go over your chronic medical issues. Um, our staff is very friendly. We try to keep ourselves well stocked so that we can meet all the needs. Um, I think that people, when they walk in the door, it's a welcoming environment. And so they appreciate that. They also appreciate that several of our staff members are of color and they feel like they're coming to be seen by someone who knows them and knows their culture and background and is willing to work with them. In some places, they feel rushed and they don't get that when they come here.
I have insurance, I don't have insurance. What all do you accept and who can come?
Well, we accept pretty much most insurances, Medicare, Medicaid, the managed care programs, and also all commercial insurances. You can do self-pay. That annual wellness visit, that's the one where patients come in, they're 65 and above, they're on that Medicare Advantage program, and we're discussing all of their health issues, making sure they're scheduled for their mammograms, their DEXA scans, their colonoscopies, getting all their vaccines, reviewing all their medications, making sure that we're coordinated with them with their other doctors that they're seeing. And so that's a visit that you do at least annually. And then from that visit, we do, all of our additional visits, but it's very important. Um, some patients also include their physical exam with that. So, but it's an important exam to do each year. And that's part of the Medicare Advantage Wellness Program.
I'm sure as a physician you think about a lot of people, especially people of color, who they need to be here.
Mhm.
They need to get their appointment. So why do you think people don't come as they should? And what would your message be to get them here?
Well, transportation is an issue for some people. Um, and the timing of hours. So we do try to make sure we're here early in the morning and we see appointments is usually up until 4 o'clock. That a lot of people don't come the way that they should is because they're afraid of the outcomes. And when they feel like they're not being treated well, or they're not being respected, or their cultures are not being honored, I guess you could say, then they're not as willing to follow along. So I had a woman just today just say that she appreciates so much that we are here, and that when she thinks about healthcare in all her time and how her mother didn't have this kind of healthcare and opportunity, and for her to be able to come here and get everything taken care of, get her labs drawn, get her prescriptions filled, get her vaccinations, see the doctor and all of that, she says that just makes her feel great, and she's ecstatic about the prospect of us growing and having more patients and more providers. So that was a really nice thing for her to say to us today. She feels at home and she's willing to make the changes. And when you take the time to explain to people and give them the information that they would need to understand, because she also had some things that were a little wrong about why certain medicines she didn't want to take. And when I explained it to her, and she was like, okay, well, now that makes sense. And I understand, and I can be a better patient and I can be more compliant. But it took me taking that time out to do that to make the difference. One patient, young lady, she is now a sophomore in high school, and I met her when her mom was pregnant, and then had her,
Mm-hmm.
and then saw her all while she was an infant and through. So
Wow.
to be able to, she's still coming to me, and that just makes me feel good that they still respect me, like me, want to come to me. And so that's what family medicine is about.
Okay, and then we bring that information up at the end. Hmm? Oh, okay, so, if someone wants to come here, how does one start? As far as new patients coming in and what, any requirements, that kind of thing to get started?
Okay, so there are no specific requirements to be able to be established here as a new patient. You can call in, you can stop by, and you just schedule yourself for a visit. It can be an establishing care visit. You can bring your medical records. If you don't have access to them, we can make a request for those. You always bring your insurance card in so that we can confirm how the billing's going to be. But again, as I've stated, even if you were a self-pay, they can make arrangements where you make payments and things like that. So it's not hard to become a new patient. We are open. It's myself and a PA, Michelle Bliley Lovelace, who is here at our facility. And then we have our medical assistants. We also do the nurse visits, people who need a TB skin test and just some of your up to date for their shots. So it's not hard to get in, and we are happy to have people, new patients.
Okay, that it? That's it, Dr. Williams.
Okay, thank
Appreciate it.
you.